I'm Rhian Wright. I'm a registered nurse and an RCN steward, and I've been a nurse for 15 years. The Nurse Staffing Act 2016 covers patients in wards in hospital who are in adult, acute and surgical wards. Patients who are nursed in these areas are guaranteed that they can be looked after by a nurse on a safe ratio that's been worked out using an evidence-based nursing tool. And basically it means that nurses have got more time to care for their patients in a holistic and compassionate way. If you've got patients that you need to give them certain levels of care, time, you need to listen to them and deliver physical care as well, and not having the time to do that, I think that's one of the most stressful parts of the job. And I think that can lead to burnout, increased work-related stress and time off sick. If we didn't have the Staffing Act, I think it would be harder for nurses to raise issues regarding patient care and how many patients they look after. Sometimes, you know, the amount of care that you need to give, it's not just about numbers. So you could have one nurse that's got 10 patients and another nurse that's got 5 patients, but actually the nurse who's nursing 5 patients has got a really heavy tasks that take time to complete, more intense care, and it's about being able to raise that as an issue to your manager if you are struggling because you don't have enough time to complete those tasks and look after those patients safely. And I think before the Act, it was harder to do that because there was nothing saying this is how many patients you should have. At the moment, it only covers adult, acute and surgical wards, which just sort of touches the surface really. At the moment, the government have put out an open consultation for children's ward, for the Act to be extended to children's wards, and we're hoping as well that it'll cover in the future mental health, community, district nursing, and all areas of nursing, so that patients wherever they are can be confident that they will get a good level of care that you know, fulfills all their needs. I think nurses can be a bit apathetic with politics, think that they don't have an influence, when they're the ones that are with patients. They've got the stories, they know, they experience it, and they could actually engage and perhaps help influence politicians, and also vote for politicians that put healthcare at the forefront of what they do, and you know, patients as a priority. So, you know, I think sometimes we ignore what's going on around, and I think a political focus for nurses is a good idea. I know nurses that have done 3 or 4 different jobs in the last 6 months because they've had to change because of the pandemic and step up into different roles. That's hard, you know, it's hard changing where you work, working with full PPE on all day. It's exhausting, and mentally and physically, and you know, they should be rewarded for the efforts that they've made and continue to make.